Have you ever enjoyed your morning coffee with your daily medications, thinking it's harmless? What if I told you that this simple habit could be quietly damaging your liver, day after day, without you ever noticing, until it's too late? This isn't just a theory. Doctors around the world are raising alarms about a silent liver threat that hides in your kitchen and your medicine cabinet. If you're over 60, this message is especially urgent. Because by the time symptoms appear, fatigue, yellow skin, unexplained nausea, the damage may already be irreversible. Stay with us until the very end of this video, because we're going to reveal the 4 most dangerous pills you should never mix with coffee, explain why your liver is at risk, and share safe alternatives you can start using today to protect your health. We'll also expose real scientific evidence, doctor-backed explanations, and some little-known facts about caffeine and medication interactions that could save your life, or the life of someone you love. So grab a seat, maybe put down that coffee cup, and let's uncover the truth that no one warned you about, until now. Most people don't think much about their liver. It doesn't hurt. It doesn't make noise. And it doesn't give you clear signs when something is going wrong, until the damage has become severe. But your liver is one of the most vital organs in your body. It acts like a master filter, removing toxins from your bloodstream, breaking down harmful chemicals, and even processing the medications you take. In fact, over 70% of all oral medications are metabolized by the liver. Every time you swallow a pill, your liver goes to work, processing, breaking down, and clearing it from your system. But what happens when your liver is forced to handle medication and caffeine at the same time? The answer: overload. And that's where the silent destruction begins. Let's be clear, coffee isn't evil. In fact, studies have shown that moderate coffee consumption can offer some health benefits. It contains antioxidants, may help with focus and mood, and even has protective effects against some chronic diseases. But when coffee is combined with certain medications, especially on an empty stomach or early in the morning, the results can be harmful, sometimes even dangerous. Caffeine stimulates your central nervous system and speeds up your metabolism, which can alter the way your body absorbs and processes drugs. This interaction can either intensify the effects of some medications or completely block the intended results, leading to 2 dangerous outcomes. Toxicity, where your body absorbs too much of a drug. Ineffectiveness, where your body doesn't absorb enough. Both scenarios put your liver in a high-risk position. Unlike the heart or stomach, your liver doesn't send out pain signals when it's under stress. It suffers in silence. People often dismiss the early signs: a little tiredness, a slight discomfort in the upper right abdomen, or a minor change in appetite. These are easy to overlook. But inside, the liver might be inflamed, swollen, or full of fat and toxins, especially if it's been fighting to filter out dangerous drug-caffeine combinations day after day. The biggest danger is that by the time you feel real symptoms, your liver could already be dealing with non-alcoholic fatty liver disease, hepatitis, or even cirrhosis. And all of it could have started with a single innocent mistake: taking pills with coffee. Before we reveal each of the 4 pills, let's understand this. This warning isn't about scaring you. It's about giving you the knowledge to protect yourself and make safer choices. You may already be taking 1 or more of these medications. And that's why, in the next part of this video, we'll break down each pill, explain the science behind the danger, and show you what to do if it's part of your current routine. Coming up, the popular painkiller that turns toxic when mixed with caffeine. The heart medication that becomes unstable in your bloodstream. A common antidepressant that interacts dangerously with morning coffee. And the over-the-counter drug you might be using weekly without ever knowing the risk. Don't skip ahead. Your liver's health may depend on this. Let's begin with the most common over-the-counter painkiller in the world: acetaminophen, also known as paracetamol. Used to relieve headaches, muscle aches, fevers, and more, acetaminophen is often taken casually, even daily, by millions of people. But here's what most don't know. Acetaminophen is one of the leading causes of acute liver failure globally. When taken in high doses or combined with other substances, its impact on the liver multiplies. And one of those substances is caffeine. How the combination hurts you. When caffeine and acetaminophen enter the bloodstream at the same time, they compete for liver enzymes. This means the liver gets overwhelmed trying to process both, and in the process, it may produce higher levels of a toxic metabolite known as NAPQI. Under normal conditions, your liver can neutralize NAPQI. But when you add caffeine into the mix, especially on an empty stomach in the morning, your liver's ability to detoxify this chemical is reduced dramatically. The result? A slow, silent accumulation of liver damage over time. The hidden risk. What makes this even more dangerous is that people often don't know they're taking too much acetaminophen. Many cold and flu medications, sleep aids, and combination drugs also contain it, meaning you could easily exceed the safe daily limit without realizing it. Add coffee to that equation, and the risk multiplies. Safer alternatives. If you rely on acetaminophen regularly, especially for chronic pain, do not take it with coffee. Instead, take it with water and food to reduce liver strain. Avoid other sources of caffeine for at least 2 hours before and after taking the medication. Talk to your doctor about liver function tests if you take it often. Our second warning is about a medication you might not know by name, but it's prescribed to millions of seniors for asthma, COPD, and other lung conditions. It's called theophylline, and it works by relaxing the muscles in your lungs and chest, making it easier to breathe. But there's a problem. Caffeine and theophylline are chemically similar. They're both part of a class of compounds called methylxanthines. And when taken together, they create a dangerous synergy that amplifies the side effects of both substances. What happens in your body? When you drink coffee with your theophylline dose, your body begins to experience increased heart rate, tremors and nervousness, insomnia and anxiety, nausea and vomiting, and in severe cases, seizures or cardiac arrhythmias. This is because caffeine intensifies the drug's effect, pushing the concentration of theophylline higher than safe levels. Your liver is left struggling to metabolize both chemicals at once, and the overload can be too much. Real case reports. Numerous studies have shown that hospital admissions due to theophylline toxicity often involve caffeine consumption, usually just 1 or 2 cups of coffee taken within hours of the medication. In older adults, the risk is even higher because the metabolism slows down with age. What to do instead? Never take theophylline with coffee or other caffeinated beverages like tea, cola, or energy drinks. Space your caffeine intake and medication by at least 4 hours. Always inform your doctor or pharmacist about your caffeine habits. If you've been feeling jittery or anxious after taking your medication, this interaction could be the reason. At this point, you might be asking yourself, why is the liver so vulnerable in all these situations? Here's why. The liver acts like a processing plant. When you introduce multiple substances at once, like medications and caffeine, it has to prioritize which compound to break down first. This juggling act can delay the breakdown of certain drugs, leading to toxicity, or speed up the breakdown of others, reducing their effectiveness. And because the liver doesn't regenerate as easily as other organs, repeated stress over time leads to inflammation, fatty liver buildup, fibrosis, scarring, and in extreme cases, cirrhosis or liver cancer. Worst of all, many of these conditions develop without pain or obvious symptoms. Which is why avoiding drug-caffeine interactions is one of the simplest and most powerful ways to protect your liver health, especially after age 60. Let's pause for a moment to talk about a daily routine many seniors follow. Waking up, brewing a fresh cup of coffee, and taking their morning pills. It feels efficient. It feels right. But as we've just seen with acetaminophen and theophylline, this habit can slowly turn into a dangerous morning ritual, especially when liver function is already declining due to age, poor diet, or other medications. In the next section, we'll reveal the third and fourth pills that should never be combined with coffee, and one of them is taken by millions of seniors to protect their hearts. It's time to break the myth that natural drinks like coffee are always safe. Because even something as innocent as your morning brew could be slowly harming your body if taken at the wrong time, or with the wrong substance. Stay with us. We're only halfway through the most important part of this video. The third type of pill on this list is commonly prescribed for high blood pressure, irregular heartbeat, angina, and heart failure. We're talking about beta blockers, a class of medications that includes metoprolol, propranolol, and atenolol. Millions of people over the age of 60 rely on beta blockers to protect their hearts and reduce cardiovascular risks. But here's where coffee becomes a hidden enemy. How coffee interferes. Beta blockers work by slowing down your heart rate and reducing the force of contraction, helping your heart rest and lower its workload. Caffeine, on the other hand, is a stimulant. It speeds up your heart rate, narrows blood vessels, and increases adrenaline levels. This creates a biological conflict. Your medication is trying to calm your heart. Your coffee is trying to excite it. And in the middle of this tug-of-war is your liver, trying desperately to break down both substances and maintain balance. Why the liver suffers. Caffeine affects the way beta-blockers are metabolized in the liver, especially propranolol. It can reduce the medication's effectiveness by up to 40%, making your blood pressure harder to control and increasing your risk of stroke or heart attack. In other cases, it can lead to fluctuating levels of the drug in your bloodstream, sometimes too high, sometimes too low, putting additional stress on your cardiovascular system. What doctors recommend? If you're taking beta blockers, avoid drinking coffee within 2 hours of your medication. Switch to decaffeinated coffee, especially in the morning. Monitor your blood pressure regularly if you consume caffeine at all. And remember, feeling fine doesn't mean you're safe. Your body might be compensating in silence, until it can't anymore. Depression doesn't discriminate by age, and many older adults take antidepressants to manage mood, anxiety, or sleep problems. 2 major types are MAOIs, monoamine oxidase inhibitors, and SSRIs, selective serotonin reuptake inhibitors. You might recognize names like fluoxetine, Prozac, sertraline, Zoloft, or phenelzine, Nardil. These medications are powerful tools for mental health, but they're also extremely sensitive to other substances, especially caffeine. The dangerous synergy. When you combine antidepressants with caffeine, a few things can happen. You may experience intense nervousness, restlessness, or anxiety. Your sleep may be disrupted, worsening mood disorders. Some MAOIs interact with caffeine to create dangerously high blood pressure spikes, known as hypertensive crises. But perhaps the most silent and deadly outcome is increased liver stress. Many antidepressants are processed in the liver using the same enzymes that metabolize caffeine. When taken together, this competition slows down the breakdown of both, leading to higher drug levels in your system for longer periods. This not only intensifies side effects, it also weakens your liver's detox capacity over time. What you can do. Take antidepressants with plain water, and avoid coffee for 3 to 4 hours afterward. If you feel more anxious, irritable, or fatigued than usual, talk to your doctor. It may be the caffeine, not the medication. Get your liver enzymes checked if you've been combining both substances for months or years. Now that we've explored the 4 dangerous combinations, let's revisit what your liver faces every single day. Imagine your liver as a highway with 4 lanes. Medications use those lanes to travel safely, get processed, and exit the body. Now, picture caffeine as a traffic jam, clogging those lanes, slowing everything down, and forcing your liver to work harder. Each cup of coffee added to your medication routine increases the congestion. And over time, the traffic turns into a pile-up of toxins, inflammation, and damage. The worst part? You won't feel it happening until you're already deep in liver dysfunction. This is why prevention is everything. You don't need to give up coffee forever. But if you're taking any of the 4 pills we discussed today, or any medications processed by the liver, you do need to make some changes. 1. Separate coffee and medications. Create a safe buffer between your morning coffee and your pill schedule. Most doctors recommend at least 2 to 4 hours between the two, depending on the drug. If possible, take your medications with a light breakfast and water, then enjoy your coffee later in the morning. 2. Ask your doctor about alternatives. Some medications have less liver-intensive alternatives, or versions that are less affected by caffeine. A simple conversation with your healthcare provider could save your liver years of strain. 3. Cut back on caffeine. Even 1 less cup per day reduces your liver's burden. Switch to herbal tea, decaffeinated coffee, or warm lemon water if you need a morning ritual. 4. Get a liver function test. It's a simple blood test that checks key markers like ALT, AST, and bilirubin. If you're over 60 and take daily medications, it's a wise move to monitor your liver health regularly. 5. Watch for subtle symptoms. Fatigue, brain fog, mild nausea, slight yellowing of the eyes. These are all early signs of liver distress, and they're easy to miss. Don't ignore your body's quiet signals. Silence doesn't mean safety. You've made it this far, which means you're one of the few who truly care about their long-term health. Not just what feels good today, but what will protect your body in the years ahead. So let's take a moment to bring everything together. Mixing coffee with certain medications might seem harmless. It's a daily ritual, after all. But for millions of older adults, it's a silent, invisible trap. The 4 types of pills we've discussed, acetaminophen, theophylline, beta-blockers, and antidepressants, all have one thing in common. They depend on the liver for safe and proper breakdown. When caffeine enters the equation, it throws that balance off. It puts your liver in an impossible position, forcing it to juggle powerful chemicals, respond to conflicting signals, and work harder than it was designed to. And because the liver doesn't scream for help, most people don't know something is wrong until the damage is already deep. But now you know better. And that knowledge is power, if you act on it. Let's be honest, your liver doesn't get much attention. It's not as famous as your heart. It doesn't get a spotlight like your brain. But without it, nothing else works. It's your detox center, your metabolic engine, your chemical filter. It protects you from toxins, pollution, bad food, alcohol, and yes, even from medication overload. And it does all this without asking for anything in return. So today, maybe for the first time in a long time, you can do something kind for your liver. Give it time to process medications before throwing caffeine into the mix. Cut back on unnecessary pills. Ask your doctor about alternatives. Get a simple liver function test. And most importantly, spread the word. Because chances are, someone you love is making the same mistake right now, sipping their coffee as they swallow pills, never realizing what's really happening inside. Here's how you can protect yourself starting today. Reorganize your morning routine. Move your medication window earlier or later than your coffee. Make a clear separation so your liver isn't under double pressure. Create a caffeine log. Track how much caffeine you consume in a day. Include coffee, tea, chocolate, sodas, and energy drinks. You might be surprised how much adds up. Have a conversation with your doctor, especially if you take any of the 4 types of pills we've covered. Share what you've learned today and ask if caffeine might be affecting your medication. Help someone else avoid this risk. A simple conversation could protect a friend, parent, or sibling. Share this video. Leave a comment. Start a discussion. Because the more people become aware of these dangers, the more lives we can protect, quietly, effectively, and without fear. This isn't about fear. It's not about quitting coffee forever. It's about timing, awareness, and balance. Coffee can still be part of your life, just not in the same breath as certain medications. By making just one small change, you may be protecting your liver for years to come. You may be reducing your risk of liver disease, cardiovascular complications, or medication failure, without ever setting foot in a hospital. All because you understood the hidden link between coffee and pills. And that puts you in the top 1% of people who don't just react to problems, they prevent them. If you found this information helpful, we have another important warning you need to hear. If you're over 60 and wake up at 3 a.m., this could be why, and how to fix it. This next video reveals a hidden connection between nighttime wake-ups and a silent hormone imbalance that may be sabotaging your sleep, your heart health, and your mental clarity. Click now to learn what doctors aren't saying, but what your body is desperately trying to show you. And as always, stay informed, stay safe, and take care of your health. Your liver will thank you.